How's it going, guys? So this is Dr. Saw at Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, NYC. So we got a guest over from California, okay? So fill us in. What can I do for you, miss?
I have sciatica pain for more than 5 years.
Okay, so sciatica going down the left leg for 5 years.
Yeah.
Okay, what else?
And I have some headache here, around here, and bloating.
Headaches and bloating.
Yeah.
Okay, what else?
I think that's it.
Okay, so I understand during a consultation, you also had a microdiscectomy a couple of years ago,
Yeah.
right?
Yeah.
And what happened afterwards?
After the surgery, I didn't feel anything better at all, and actually I feel worse. I got bloating and got headache.
So ever since since after the surgery,
Yeah.
you actually feel worse.
Yeah, I feel worse.
And still didn't help with the left side.
No.
Okay, and on top of that, you got more bloating and gas and the headaches since then.
Yeah.
Understood. Okay. All right, let's take a close look, see what we got. First things
Okay.
first, go ahead, just walk up and down this hallway. Okay, stop right there. Okay, so we already could tell there's something going on because, yeah, see, there's a lot of, comparing her right foot to her left foot, there's a lot of edema going on. And also, if you take a sit over here, please. This edema has been here for so long. See how shiny it is over here? Okay, so her vascular system is compromised. It is just not functioning as well as it should. It can't just pump all that interstitial fluid out of the way over here. So, in addition to, okay, you go ahead and stand up for me, please. As you can see, her gait is compromised. See how her toes, nice and firm, flat on the floor? See this? It's all off the floor. All right? So yeah, there is some serious nerve compromise going on into this left foot over here. Okay, so what we do right now is called instrumentation. The purpose of the device is look for any abnormal temperature as a result of the body's inflammatory process to initiate healing. Now, in order for the body to heal, when there's a damaged tissue in the area, what it starts doing is it increases the vascular supply in the area. And so there's more blood in the area. What it does, byproducts, it's going to be heat. And that's what this device here picks up. And we found another one at this level here as well, way down there. And I believe we saw another fella, something to the right. Yes, we did. Right there. Okay, so there's quite a bit of edema pooling everywhere. So I'm seeing one big patch over here. We see another big patch a little straight down here, and I also see a huge big bulge right over here. So the body is clearly defending and protecting, stabilizing something. Just checking all the segments. This is compromised. That's not moving whatsoever. Okay, ilium is moving just fine. That's also moving just fine. Okay, so this 2S is in trouble. See, all that, everything else is moving just fine, but this 2S is not. Okay. And also got quite a bit of swelling going on. This fourth lumbar is not moving that great. Fifth is moving just fine. Fourth, nope. That fella is not moving. So yeah, we got the nice little pitting edema just sinks in right there. Whoa, that's not moving. Ah, sorry, I know it's a little uncomfortable there.
Mm-hmm.
Okay, we've got some fluid over there. Okay, that's not moving. That's not moving too well. that fifth cervical's in trouble. Right there. All right. Now, the previous MRIs, the reports stated that, yeah, you had a disc bulge on the fourth lumbar disc. Mm-hmm. And it was irritating that, well, the fourth lumbar nerve going down to your leg. The needle EMG follow-up shows us that there's anything really significant in terms of any impingement or decrease in nerve function. Doesn't really show that. Now, the fact that you had a surgery and you still had that problem, this is what's called failed back surgery syndrome. Okay, it's an actual medical term, all right? And that's a result of after the surgery, you're expecting to feel better or symptoms reduced, but nope. Either the symptoms are still there or worse, and you clearly experience worse, right? And we still see some kind of neuropathy because you're not walking properly either, and you have trouble walking on that left foot. Yeah. Now, there's a nice discontinuity, just a space. Yeah. This is actually supposed to be all in 5 pieces, but no, you have one heck of a space over here, and that tends to confirm on you, that's where the trouble spot is. So because of this foundation over here is unstable, and I'll take a closer look over here, all these segments are supposed to be a straight line. But right over here, that's where things start to tilt. Yeah. From here, and it tilts this way. So I need to realign that, go back down this way. So when it comes down that way, then this spine as well will start coming down, but we need to still, I strongly believe we need to adjust that as well. There we go. There we go.
Feel release a little bit.
You feel a release of the gas a little bit. By how much? From 0 to 100%? How much would you say? Less?
Maybe 50.
50% less gas. Yeah. Okay, that's a good start. Yeah. All right, so we got some stability. Let's go ahead, let's take a look at everything else. Yeah, fella right there? Yeah. Yeah, still pain, right? Yeah, still swollen, still stuck. See, I could tilt your body to the left. See, that's not moving whatsoever to the right. Yeah. So we still need to address this, fella. Okay, come on now. Go ahead, walk up and down the hole. Okay, all right. Tell us, what's different in there?
I feel something going on.
You feel something going on? Yeah. What's going on in there?
Kind of feel a little bit like a sensation, go up.
You feel the sensation is going up?
Yeah.
Okay. How's the walking on the left foot?
I feel a little bit stronger.
Stronger?
Yeah.
Okay, how much stronger would you say?
I think I should say 50-50.
50% improvement, 50% stronger in the left foot. Hey, that's great. Okay. Yeah. All right, let's get to the next one. Now we are retesting this fourth lumbar over here. And it's pivoting better.
Yeah.
Okay, good. So we're gonna let that fella heal up. I'm gonna take a look at this fella over here. So, see that? That's pivoting so much better now. Feel that difference right there? You feel anything? Nothing, right? So even though before this was very stuck and there was a reading over here, no. Because we addressed this, it took all this biomechanical strain off of this fellow over here. We're not going to be adjusting this one. Feel that difference? So what were you saying? How's the neck right now?
I can move better.
You can move better. How much better would you say?
80%.
80% better? Yeah. And that's great. Yeah. So that's why it's so important to address the root cause of the problem. So even though there were some indications to address that mid-back and also the neck, no, that's why I always do a post-check and to see if it really needs to be addressed or not. It doesn't, right? So those are just compensations that turn into a subluxation I want these two to heal up a lot more. So here's what we're gonna do. This is all we're gonna be doing adjusting for today. I want this fellow to heal up, right? So you're gonna put ice on it,
Okay.
20 minutes, 3 times a day, right? And I'll see you in the next visit.
Okay.
Okay?
Okay.
See you next
Thank
time.
you so much.
Oh, you're very welcome. Okay. All right, so as the viewers can see, her toes are finally touching the floor over there. Now, if you remember from before, it was couldn't touch the floor at all. So tell me, how are things? Give us the latest updates. How's everything coming along?
Yeah, I feel much better. But headache, no more headache.
No more headaches.
Yeah,
Right,
no
that's good.
more. And loading is a lot better.
Bloating is a lot better.
Yeah,
Right?
that's only the leg pain still here, but get improved.
Getting improvement. Okay.
Yeah, yeah.
How's walking? You mentioned one of our visits, you were able to walk just 1 block.
Yeah.
Now, how long are you able to walk now these days?
Yeah, I still walk a little bit more,
Okay, so how much more?
like 2 blocks or something.
2 blocks more.
Yeah.
All right, that's great. All right, I'm still gonna work on this. Little more. Little more. Great set. Okay, come on up, please. Okay, walk up and down the hallway. Good. All right. How's it now? What's different about it?
My toes can get close to each other. I can see before my toes like this, like curling.
That's correct. The toes was curling and spaced apart. Now
Yeah.
they're a little more approximate to each other.
Yeah.
That's good. All right. Well, I'm glad that things are working out, progressing. But as you can tell, there's still a lot of extensive damage in there. So we're going to recommend you a Gonstead Chiropractor in LA, and I strongly recommend continue with the progress.
Yeah.
Right? All right. Have a safe trip back home. Right? Have a good day.
Thank you, doctor.
Oh, you're very welcome.
Thank you so much. Thank you.